care of all those bad things. And we're trying to make sure that we still have a real positive agenda about protecting Colorado, strengthening our economy, creating jobs, creating opportunity. I serve on the budget committee, and so I actually I'm the chair this year, and I have the great fortune of getting to write the state budget in a year when we're actually seeing revenues come back, and we're going to be able to do some really important things, I think, in this year's budget that we can all be really proud of as Democrats that show our values. This week we got into some health programs, and we expanded funding for school-based health centers for low-income kids that access health care at the school-based clinics. We don't have enough of those. I mean, in my perfect world, we have one of those in every school. But we did a significant increase to really expand the scope of those. Also, some other youth services programs. There's a Tony Gramscis youth service program. Significant new dollars going into that. And one of the other things we've done so far, and I know I was talking to Joe about this earlier, state employees, government workers, the people that provide all these services, the people that smile and answer the phone and make sure you get your unemployment or your driver's license or your hunting license, whatever it is, they haven't had a raise in 4 years. And instead, their health care premiums have gone up and up and up, so their paychecks are stagnant, and the amount that's being subtracted for their share of their health care premiums keeps going up. And it's been a really bad trend. And so this year, for the first time, we actually have seen healthcare premiums flatten out or actually even decrease slightly. And so there's not going to be a bigger bite out of state workers' paychecks for healthcare this year. And for the first time in 4 years, we are funding what we call the salary survey, which is how we do pay raises for state employees. They're based upon what's happening in the private market. We haven't funded that in 4 years, so we've fallen way behind. And we actually went a little better than the governor asked us to do and went an extra 0.5% in terms of funding the salary survey. So state workers are actually, for the first time in a while, going to see their paychecks try to help them keep up with inflation. They've fallen behind. They need more help. But this is just one of the examples of what we're doing for working families and for the people that make our state run. And one of the things we're doing in the state budget that I think when we introduced the Budget Act at the end of March, and that's how long it takes us to write it, and we're still working on it. When we introduce that bill, I'm really hopeful that it's going to be a bill that I'm going to be really proud to sponsor. And just the little things we've done so far, we've only gotten into about 5 or 6 of the state departments yet. But with state employees, with school-based health centers, and with a whole lot of other things, I think this is going to be a budget that really reflects our democratic values and shows how our heart really is in helping those in need, helping the most vulnerable, doing what we can to protect Colorado's economy and its environment and all of its people. So I'd be happy to take any questions if you want. And if not, I'm going to run off to House District 8. Yes, sir.
Yeah, what's your position on 127, Senate Bill 127?
127. This is a bill that would take sales tax revenue and put it into the Older Coloradans Act fund. And this happens right now, and the fund is able to keep, I believe right now it keeps $8 million a year for services for seniors. This is what funds a lot of Meals on Wheels programs, for instance, and a lot of other senior services. Senate Bill 127 would increase the amount of sales tax revenue that goes into that fund by $4 million in this year, and it actually would require a $4 million increase each year for 3 years. And so it's a pretty significant commitment to increasing funding for senior services. I'm supportive of trying to do what we can. I don't know if $4 million is going to be the right number in the final analysis. It may end up being $2 million or $3 million. I don't know if we're going to actually commit the second and third years worth of increases this year, or if those are decisions we'll make 1 year at a time. I'm a little worried about just uncertainty in the economy, and because this would write those increases into statute, and the Budget Committee wouldn't have control over them. So I've been talking a lot with folks from AARP and Dr. Cog, and Senator Lucia Guzman from Northwest Denver is the sponsor of this bill, and she and I have been talking a fair amount. I mean, this is a bill I think we're going to pass, but whether it's $2 million, $3 million, $4 million remains to be seen, and whether it goes into the future, those decisions remain to be seen. One of the things that's really important in our budget process is on March the 18th this year, we're going to get our quarterly revenue estimates where our economists tell us how much tax revenue is coming in. And all indications are right now that the economy is definitely strengthening. Unemployment numbers are down, housing sales are up, manufacturing, all the economic indicators are telling us, our economic recovery is continuing to get stronger. And so I'm expecting pretty good news when we see that March revenue forecast, but that's really going to be one of the final deciders on exactly how much we have and how much we can afford to commit to that Older Coloradans Act. But I'm very supportive of doing something there, and I think you're going to see something good happen, but some of these decisions are going to be made right at the end of the budget process at the end of March. Any other questions? Elliot?
So how long do they have to be in committee before you can kill them? Hour? I mean, literally down to the minute. I'm serious. I mean, it seems a waste.
The gavel amendment, and do you all know Wayne Knox, who used to represent House District 2? Wayne was one of the prime movers and authors of the gavel amendment back in the 80s. And it was put into the Constitution to stop the abuses that the Republican majorities used to do back in the day, where they would never even give Democrats' bills a hearing. It would just be a pocket veto, and you wouldn't even know that Democrats had any ideas at all. They never got put on the table. And so the gavel amendment said every bill gets a hearing. And actually, if you're in the minority party, which I remember when Democrats were, at least our ideas saw the light of day, got talked about, and the Republicans had to, look people in the face when they said no to bills like 127 that help seniors. The gavel amendment was well-intentioned. It has really made the legislative process really hectic this time of year, and a little ADHD, if I can, diagnose legislative mental disorders, because it really, there's so many random bills on so many crazy topics, evolution and letting federal marshals, or not letting federal marshals have jurisdiction in Colorado. The Republicans have had some really crazy ideas this year. And every single one of those has to get a hearing, and sometimes those hearings can take several hours. And that's why February is just such a chaotic time at the Capitol.
So there's no minimum time? That's where I'm going is it built into the law, or do we need to build it into the law?
It's not.
The minimum time is an hour.
It's not. It's up to the committee chair. And I'll tell you, because I've chaired committees where we've heard bills like this. And, if a whole group of people shows up wanting to talk, it's really hard to be a committee chair that doesn't let the public, people that travel to the Capitol, have their say. And as Democrats, we generally believe that our democratic process works best when people have their say. And so we generally don't shut down debate. Now sometimes, these gun bills that were heard in committee the other day, those went on for hours and hours and hours. And sometimes you'll put an outer limit on it and say, the hearing's only going to go 3 hours. Or we're going to let every single one of you testify, but you're only going to get 3 minutes. They'll try to do some limits like that, but our values are that we want the public to have a role in this process and feel like their government hears them and responds to them. And so every bill gets a hearing.
On that note, we'll close discussion. And we had a couple. We had a couple more questions, but we are full of time, and we've got we'll take a couple more and move on.
I saw in the paper that they're going to be attempting to extend the sales tax on cigarettes indefinitely. Now, is that also going to allow cities and counties and special districts to put a retail sales tax?
Short answer is no. For the past 3 years, during the economic recession, one of the things the legislature did just to try to avoid really deeper budget cuts was we made cigarettes subject to sales tax. They didn't used to be sales tax. There was a special tobacco tax, excise tax on cigarettes, but we didn't put the state sales tax on them. State sales tax is 2.9%. Your cities and your special districts like RTD, have additional increments, but the state gets 2.9% sales tax. And by putting those on cigarettes, the state brought in like 25 million more a year. And so that's 25 million, we didn't have to cut out of K-12 or higher ed or anything else. So it was being passed as a temporary measure for budget balancing. It expires this year on June 30th. And I'm sponsoring a bill with Daniel Kagan to actually make cigarettes permanently subject to sales tax so that this money doesn't go away. And more importantly, so that tobacco taxes don't go down. It's really bad public health policy to have tobacco taxes go down, because all the studies will show you that those taxes are a barrier to young people starting smoking, being hooked on nicotine. And so just as a matter of public health, I don't think we should let the tax go down. It also brings in extra money that wasn't projected in our budget.
What are we getting out of that, Todd?
Actually, the projection this year is $28 million a year.
Sorry.
And so when you look at things like Senate Bill 127 and funding for senior services, things like keeping the sales tax in place on cigarettes is going to make it possible probably for us to do something to fund 127 and some other great things. So, this is the kind of stuff I love. And when you get into this tax policy, wheeling and dealing on how to bring in more money and how to make sure we sustain our revenues and have money to do what's right. That's why I'm really enjoying being chair of the budget committee this year.
Way to go.
All right.
Thanks, Pat.
I'm going up to your open house yesterday. I'll see y'all next month or at the Capitol sometime soon.
Thanks, Pat. And we'll go on to Irene. And just a reminder, if anybody came in late, we've got about 6 minutes per elected official. So I'm giving you a warning when you got 5 minutes, or 1 minute after 5.
Just took up one of my minutes. How are you guys? Actually, I just have a couple of things I wanted to report. And the first and most important is that the Colorado Foundation for Universal Healthcare yesterday did release the economic report on my idea for reforming healthcare in the state of Colorado. It's called 3 Possibilities for Colorado's Future, Healthcare Financing and Delivery. And to get you to the punchline, if we were to redesign healthcare in the way that I am proposing, as opposed to the Affordable Care Act, we would decrease our health expenditures from 14.5% of the GDP to 14%, and then in 2024, we would be at 14.5% compared to 18.5% of GDP if we were to re-implement this plan and idea. And then the other thing is that the per capita spending on healthcare, that results in a $2,427 per person reduction in healthcare spending in 2024. So if you go onto the website, the Colorado Foundation for Universal Healthcare, you can find an executive summary that's just 3 pages long that sort of gives you the highlights, and then the long economic analysis that tells you all the other information about how these numbers are derived and what they mean and where they come from. What this means for you as the average person is that, are any of you business owners, small business owners? So, as opposed to what you do now in terms of paying or contributing to health insurance, if you're able to do that, and paying for the medical portion of workers' comp, you would have a flat 6% payroll tax, and that would be it. You wouldn't have to do anything else with respect to health care for your employees. The employee would need to contribute a flat 3% payroll tax. So for those of you who only worked at a job where you were salaried and had no other income, it's 9% cost total, 6% employer, 3% individual. If you're self-employed, you would pay that entire 9%. And the rest would come from monies from the federal government that are currently going to be expended for Medicaid and for the Affordable Care Act. And that would cover the rest of the premium for the state of Colorado. And what you would get in exchange for that is what would be the equivalent of an Affordable Care Act Platinum plan, which is the highest plan, or a 90% actuarial plan. And it would include some dental benefit as well. And so a much richer benefit for no hassle and less costs. And so if like me, you came to the legislature only because of health care, no. You're interested in. So my actual bill draft, we're finalizing it. We're hoping to have it right across the table on Friday. And Friday from 4 to 7, there's a reception at the Gilpin House, which is a beautiful home that an advocate has donated for our use for this work at 1750 Gilpin Street. And so I'll be there, obviously, sharing with people the bill and answering any questions you might have. And then on Saturday, we're having a kickoff for sort of building momentum around getting this through. And that will be at the First Unitarian Church in Denver on 14th and Lafayette. It starts, for those of you who have a real interest in this, at 8 in the morning. I'll be giving a lecture between 8 and 9 on the history of health insurance in the United States. to sort of set the context on which we then, at 9 o'clock, talk about the cooperative bill. And then we've invited a panel of people like a business owner, a medical provider, a consumer advocate to respond to what they've heard and give you sort of their perspectives. And then we'll have about an hour for questions and answers from the audience. The event itself is free. There will be a lunch that's offered for $10 if people want to buy lunch. And if you go to either the Foundation for Universal Healthcare, but there's a website called Cooperate Colorado, and that website has all the details. And if you plan to come, RSVP. That way we know how much food to purchase and don't lose money on the food. So that's the biggest thing I wanted to tell you. The next thing I wanted to tell you is that Speaker Ferrandino and I will be carrying the bill to ensure Medicaid is expanded in Colorado. And this past 2 weeks, there have been 2 reports released, one by the Colorado Trust, that sort of gives you a quick 4-page, what is Medicaid, what does expanding it mean for Colorado. And if you Google Colorado Trust Medicaid expansion, it'll come up. And then the other one this week was by the Colorado Health Foundation. And they commissioned Charlie Brown and those guys from DU who do the economic analyses to do an economic analysis on Medicaid expansion for our state. And what they showed was that it would, over the next 10 years, create about 24,000 jobs and increase our economy by about $2.8 billion. And so it's not only the socially just thing to do, it's the financially sound. It is a job creator and economic development job as well. And so I'm really excited to be part of that effort. The final thing I want to tell you about is tomorrow, for any of you who've not had enough politics this morning, between 12:30 and 2, there are 2 great events at our Unitarian churches. The one on 14th and Lafayette, I won't get to go to, but they are actually having someone to talk about the whole Israel-Palestine issue and what's the background of that and what should our role as citizens of the United States be. And then the Unitarian Church over on Colorado and Hampden, I'll be part of a panel there to talk about immigration reform and health reform. And that's from 12:30 till 2 tomorrow. And then my next town hall is a week from Tuesday with Speaker Ferrandino, doing a joint one at Hirschfield Towers. Wednesday, sorry.
It's like, huh?
I better make sure I have that right on my calendar. Anyway, we'll be at the Hirschfield Tower at 333 West Ellsworth. And Patty Fontenot from the Colorado Health Benefits Exchange will be coming to update us on the exchange. And so, as those of you who know my work better, what I'm trying to do is actually put a referendum on the ballot to completely change our healthcare system, because there are a few people who make a lot of money in this industry that might put some money into advertising to kill this effort. We want to keep moving forward with the Affordable Care Act provisions, which are already in progress. And so that's what Patty will be able to tell you about next Wednesday at the Town Hall. I'm headed over to the Latino Initiative meeting this morning, so that's why I needed to leave early. But I'm happy to take questions as well. I've stunned everybody into silence.
I just wanted to mention there's a clipboard going around if you're interested in signing up to help with the healthcare cooperative bill.
And also, if you want to be sure you get on the email list to get these announcements for the events that are happening and updates on what's going on with this effort, you can sign up on Vicky's board. And there's also a tiny little sheet that gives you a few bullet points about this effort, and it gives you the linkages for the website where you can quickly get to more information.
You know, something you just said, you know, we keep hearing the Republicans talk about raising the Medicare age, and other people say that that doesn't save any money because you still have people who need help. Is there some place that we could go and get a little smarter on the pros and cons of that, so that when we're in a discussion we can kind of repeat those points?
I'm trying to think if there is specifically, and not that I know of off the top of my head. I know that the federal government has healthreform.gov, and they have a lot of health reform information on there, so that might be helpful to you. One of the things, and this is sort of the 8 to 9 o'clock part of my lecture next week, that people don't realize is that the price of an insurance product is based on who you're insuring. And so what happens is if you raise the Medicare age from 65 to 67, those 65, 6-year-olds are now in the risk group with everybody else, and they tend to be more costly. So what would happen is that instead of paying for them through Medicare, you'd be supplementing them with your private insurance premium. So you don't get out of paying for it, you still pay for it, it's a question of how. And if you look at, right, and if you look at like per capita costs, Medicare is much cheaper than private insurance. So you're really switching them to a more costly option that you'll pay for through your health insurance premium instead of paying for through your taxes to be in a lower cost option.
That's the key argument.
Yeah. Yeah, because they're still going to be paid for. The question is how it happens, right? And in this way, it happens through the insurance industry, which has a much higher overhead than Medicare, which has a very low overhead and cost.
And so in your first, the first proposal that you talked about, does workman's comp go away?
Workers' comp doesn't go away because workers' comp also covers ongoing disability and liability. So if you lose your job because of this injury at work, they're going to have to pay you money or settle with you. They still need insurance for that. But the medical portion of that premium will go away, and all of your medical care will be paid for through the cooperative, with the idea being that one of the things that happens to people now is if you get injured on the job, you have to go see a workers' comp doctor. You can't just see your own doctor. And then once the workers' comp doctor says, well, I don't think this is related to the injury anymore, all your care gets transferred back again to your regular doctor. And I just don't think that's good for the patient. It would be better to just see the same doctors the whole time. So that's what my model would allow. And same for the medical portion of auto insurance. All of the medical portion of auto insurance would now be covered underneath this universal plan for the state. And you wouldn't have to do the same thing when you see your insurance doctors and then go see your regular doctors afterwards.
Okay.
What happens to people in that age group or in their late 50s who are not working and are not old enough, also not old enough for Medicare?
So the way the premium is collected is based on payroll and income. So if you have no payroll, no income, you're still covered, you're just not paying the premium.
Wow.
Okay.
Thank you.
Great. Thank you very much. You ready, Mark?
Yeah.
So